Welcome to Knowledgeable Aging. I'm your host, Jason Kotar. Join us today to talk about aging versus inactivity is Dr. Chanel James. Dr. James, a native Washingtonian, is CEO of Limbs and Things LLC, a mobile and telehealth physical therapy practice, and a licensed physical therapist. Dr. James is the Secretary of the American Academy of Physical Therapy, a member of the American Physical Therapy Association, and active within its DC chapter. Monthly on Saturdays at 6 p.m., Dr. James talks with local businesses and professionals on Pull Up with Limbs and Things live on YouTube and Facebook to discuss topics pertinent to aging and physical function. How are you doing today, Dr. James?
I'm good. How are you?
I'm doing very good. Thank you for joining us for the webinar. I'm looking forward to our conversation. But before we get started, for those that are joining us for the live webinar, you should see a toolbar menu on your right-hand side. If you have any questions, I encourage you to type your questions in. Time permitting, we will do everything in our power to get your questions answered. So Dr. James, I'm going to turn over to you.
Thank you. Good morning, everyone. Let's talk about inactivity versus aging. All right, so these are statements that you can complete with me. Nothing says I'm aging gracefully like. For me, it would be tone muscles and skin. If I see someone who has tone muscles and skin, I'm thinking that they're not as old as you may think. Nothing says I'm getting older like. How would you complete that statement? For me, I'd say gray hair. Nothing says I'm sedentary like, what would you say? For me, it would be being out of breath with little activity. So being out of breath with little activity, you can be going up the stairs or just getting up from your chair and feeling like, oh, I'm so out of breath. So what really is inactivity? It's just a reluctance to take action. And aging is the process of growing old. So we're going to talk about a few different things, and you can think to yourself or you can type in the chat whether you think it's inactivity or a sign of aging. So the first one is weakness. I'll give you a moment to think about that. Is it inactivity or is it aging? Loss of balance. Is that inactivity or aging? What about joint stiffness? What would you say about pain? Yes, there could be some that would be considered both. All right, hearing loss, inactivity or aging? Reduced eyesight, inactivity or aging? Stiff blood vessels, inactivity or is that aging? And then drier skin. All right, so weakness, loss of balance, joint stiffness, all of those are inactivity. Pain can be inactivity or aging, depending on what has happened during your life. Hearing loss, reduced eyesight, drier skin, and stiff blood vessels are all signs of getting older. All right, so let's talk about pain and joint stiffness. Both of these can be considered inactivity because if we have stiff joints, that usually begets having pain upon moving because we're moving in a less familiar position. If we're sitting more throughout the day, that we tend to have stiffness in our knees, stiffness in our back, our shoulders. And so when we get ready to stand, we find that that stiffness becomes a little bit painful when we're stretching out those joints. And then our joints have less lubrication and range of motion. So if we go back to the example of sitting, our knees are flexed. When we stand, our knees are extended. And then even in your ankles, the same situation occurs. Those are what we consider inactivity. Hearing loss and reduced eyesight. Now this is more of an aging sign because it's usually due to reduced blood flow in your ear canal as well as in your eyes. And we tend to see this more with the need for reading glasses as we get older. Or I'm sure we've all experienced hearing a TV turned up much louder in someone's home who's older. When I was visiting my grandmother, she had this long sidewalk that led up to her house. And by the time I got halfway to that sidewalk, I could usually hear her TV. So that's an example of having hearing loss and reduced eyesight as you get older. So let's talk about weakness and loss of balance. This one we're looking at more from a way to combat this inactivity. We need our muscles to actually pull on bone so that bone remains strong, but it only does that with some demand. So the demand could be your body weight, or the demand could be if you are using a free weight, that would be another example. So in this picture, you see a challenge to your balance by what we call tandem stance, which is standing with one foot in front of the other, kind of like you would do on a tightrope. And this is an example of how you can combat inactivity by challenging your balance. Another way to do it is just standing with your feet apart and closing your eyes. Doing that challenges your proprioceptive input. It challenges your vision, seeing how much vision plays a role in your balance, and then helping you to determine, do you need to reach for something or are you able to maintain your balance? If you do practice that, you want to make sure you can hold that position for at least 30 seconds. All right, and then another way to improve your strength is to bear weight on your arms and legs. So a lot of times we think it has to be only free weights that we use for our arm strength, but you can push something, you can pull, you can take your groceries out of the car, you can push down when you're standing up. All of those are practical ways to improve the strength of your arms and legs. All right, so let's talk about dry skin and stiff blood vessels. I know I like hot showers, but as we get older, hot showers are probably not the best thing for us because water loss occurs from a layer of our skin, and that means that moisture retention is not as great. So we want to decrease the water temperature so it improves the moisture retention in our skin. So you can have a warm shower instead of a hot one. And then having movement that lubricates from the inside of our bodies out. So just like a car that needs oil in order for it not to creak and make different sounds as you're driving it, you need the oil of movement to your joints and your muscles so that you don't hear creaking and cracking sounds when you're walking or moving around. All right. Stiff blood vessels, we attribute these to aging sensors in our body. Unfortunately, there's not much we can do about it except possibly changing our diet, but they're called baroreceptors, and their job is to prevent us from having dizzy spells when you stand too quickly. And the key to doing so is having flexibility. So if a lot of times we have stiffness in our neck, but we have some really vital vessels right in our neck. And so we need to every day take your neck around, raise your shoulders up and down, and try to make sure that we're getting as much flexibility into our bodies and regular movement as possible. Are you seeing a trend? Movement is helpful for so many areas of your body. All right, so what can we do about inactivity? These are my children, but they can also be you. You want to walk, work in your yard, or practice just standing. Standing with your feet together, standing with your feet apart, standing with your eyes closed. Working in your yard can be from something minor to something more strenuous like shoveling your snow or gardening. And walking doesn't have to be anything that is only outdoors. You can walk in your home, you can walk up and down the steps, you can walk outside and gradually increase your distance. So what can we do about aging? A lot of times as we get older, we're all looking forward to retirement. But we're looking forward to retirement from the fact that we don't have to do any work, but we also have to have a plan for moving on a regular basis. It doesn't have to be that you're getting up on a scheduled time, but when you do get up, what are you doing with your time? You want to make sure that you're not sitting so much that you're not standing equal parts. And then engage in something fun with possibly an accountability partner. It encourages strengthening of your mind as well as movement. And spending time with pets or younger family members, it is true that children do help keep you young. And then refusing just to be inactive. And if you're noticing, of course, any difficulty staying active, you can see a physical therapist. And then for me, maintaining a close relationship with God is important as well about aging. So when should you see a physical therapist for inactivity? A lot of times we think a PT is only for after surgery. or when a rehabilitation need is there. You can also see us when moving hurts, when you just want to move better, or you've had a change in your functional status. That's the one we're all most familiar with. So what do we do as physical therapists? The most important thing we do is we analyze what you say, how you say it, and how you move to determine the cause of whatever movement challenge you're having. So in analyzing what you say, we tend to hear the things that are plaguing you the most. How you say it determines exactly that impact on your life and how that pain, if it is pain or movement, that is really causing you to not do some of the things you want to do. And then how you move says a whole lot about if it's muscle, if it's joint, if it's nerve related, if it's more of an endurance situation. So physical therapists are looking at so much more than possibly what you may think. And then we address those movement challenges by, of course, prescribing exercise. We may even prescribe an assistive device like a walker, a cane, crutches even, use of modalities. So electrical stimulation, ultrasound, all of those things, as well as like traction, and then position adjustments. Say if someone is in a wheelchair, making sure that that position or a cushion or a leg rest is elevated to the point that your positioning in the chair is optimal for you. And then postural correction, just to make sure that you're not hunched over, you're not doing anything that would potentially cause another problem. And then, of course, gait pattern and sequencing. So we look at how well you are stepping, if you're using more energy by taking smaller steps versus a step that's commensurate to your size. All right. So as a more global picture, we treat 5 major systems. Our goal is either to rehabilitate, to maintain your current function, or just to prevent movement dysfunction altogether. So those 5 areas, the first one is your integumentary system. We look at wounds, scars, the skin integrity, and its role of movement. Kind of like what we talked about earlier with our drier skin. So I usually work with people who have amputations. And so I'm looking at their wounds from the standpoint of if it's healing properly, if there's any sign of infection. Those are things that we look at as physical therapists. With the musculoskeletal system, post-joint replacements and amputations falls in this category as well. So in post-joint replacements, I had a patient who had a total knee replacement, and her scar line, she had recently had the incision, the stitches, they dissolved, and her incision line was raised and it was red. And so we just worked on making sure we did cross-frictional massage to strengthen out the line in the skin, as well as to improve her motion. And once the skin healed, we were able to move that limb a lot better. She was able to walk up and down the steps with not a problem and without an assistive device. So the neuromuscular system, post-stroke, brain injuries, multiple sclerosis, there's so many other different diagnoses that we work with, but the main goal in that is to help the neural system or the neuromuscular system to work well with your movement. So we're looking at how you move, but also how those nerves are innervating those muscles so that you get the most return of function. And then with your cardiopulmonary system, we've seen a lot of people post-COVID-19 needing to return to function, and our main goal there is endurance training, trying to ensure that when you get up, you're not losing your breath. When you stand for a while, you can do more than one activity while you're standing. So all of those things are improving not only your lung, but also your heart function as well. And then the cardiovascular system, that one is primarily your heart. And so we're looking at how that blood flows into your heart. We're testing you a little bit with treadmill activity possibly, or a walking routine, so that you can either post-heart attack or post-vascular surgery have all of those blood vessels flowing to each area of your body and not having a problem with movement. So that's the scope of practice. That's everything a physical therapist does. It's been a pleasure speaking with you. Thank you all for attending. If you have any questions, I'll take them.
Very good. Thank you, Dr. James. I've got quite a few questions that have come in. First question, what should people be aware of from a safety standpoint before they do strengthening or balance exercises?
Good. Okay, so the main thing you want to be aware of is your balance, right? So you want to make sure when you're getting ready to do something, I always tell people to test your balance when you initially stand. You want to make sure that you don't feel dizzy, that you have eaten, especially considering all of the other diagnoses that could be going on, your past medical history, the medications that you may be taking to make sure that you are safe to do that activity. If you are needing to take your blood pressure on a regular basis, your blood sugar levels, all of those are in a normal range before you begin. And so taking your vitals is a vital point before you begin physical therapy or any movement activity.
What dietary changes should someone consider to assist with stiff blood vessels?
Dietary changes. Oh, yes. So we talked about that. So if you think about atherosclerosis or anything that would cause plaque in your arteries, so having a heart healthy diet, those things that are low in salt and sodium, those are most beneficial to decrease your chances of having any issues there.
What is an accountability partner?
Oh, yeah. So it's just like having a friend to do different activities with you so that you are fully making sure that you're not forgetting anything. And a lot of times when we have someone who's reminding us, oh, did you go walk today? Did you come to this class with me? All of those things kind of make you more interested in doing the activity. It provides a socialization outlet as well.
Will insurance pay for a physical therapist if you hire one without a doctor's recommendation or prescription?
Yes. So in DC and Maryland and Virginia, there's something called direct access where you can see a physical therapist for, depending on the state, a particular period of time before you would need a referral from a physical therapist. So yes, you can see us first.
How has COVID impacted, or what have you seen in your clients as a relation due to COVID with regards to activity versus inactivity and their overall health when it comes to aging?
That's a really good question. So with COVID, I've seen, of course, more people sitting more, staying in their homes more. But I've also seen the opposite in some people engaging in new activities outside their home, whether it be in their yards or in finding an online method of exercise. And so both of those are kind of good and bad ways to address COVID. But I think the best thing that has happened is that people have sought more movement than ever because either you had to or you found a way to have both the outlet of socialization and movement.
Yeah. With your industry, physical therapy, what
Mhm.
advice do you have for a loved one who thinks another loved one may need physical therapy?
Oh, yeah. So a lot of times people, I think you should approach it in a different manner. So you should say not physical therapy because I don't know, somehow people think, we're tortured. So you want to say it in a manner that is fun for them. Like, when do you want to move better doing this? Wouldn't it be helpful if you could do that with no help? Or wouldn't you like to see yourself do this without feeling like you're completely out of breath? Well, this person can help you. And maybe that is a method to turn it around so that they don't think it's going to be a bad experience.
Is it safe to say that inactivity is the main reason for injuries and the reason why you get a lot of your clients because they're inactive, or is it because they're active and they do something to injure themselves?
A little bit of both, but more so from the inactive side.
Okay.
Yeah, because a lot of times people find that once they get up and try to do something that they thought they could do before, they find that they're either not strong enough or they fall, and they find that they're not strong enough from that, or they find that, "Oh, I just can't do it as well as I used to." And I think that's more of what the population I serve is, people finding that I just am not doing it the way that I want to, and for me to be independent living on my own.
What would you say to people that like to use Dr. Google when it comes to physical therapy? Do you have anything you'd like to say to them? Because, they may say, hey, my
Yeah,
back hurts, and they go online, and next thing you know, they're doing something totally different, and they injure themselves more. What can you say to those individuals?
I think you should always do your own research. However, you have to take everything you read with a grain of salt, because Google does not know you. And so when you have someone that's a physical therapist who is coming to you in order to find out a little bit more about you, what's your routine, what is something that your past medical history may be affecting your movement, all of those things Google can't necessarily tell you. So you can see what you think Google might say. I think that it's always important to do your own research, but don't take Google as the last word or the final word.
That's a good one. Thank you, Dr. James. Couple more questions have come in. So, does physical therapy help with cognitive issues?
Yeah, so I have had a few patients who've had Alzheimer's or dementia, and a lot of times with movement, just like with dance or with music, we can use both of those things, but helping someone to either count while they're moving or to be able to list your colors while you're moving, doing a cognitive task while you're doing a movement task helps to improve not only your cognitive, but your physical as well.
What is the role of the care team when it comes to your physical health vis-a-vis your primary care, your physical therapist? What does that look like?
Okay, so our goal is to work together, because I want to know from the physician standpoint, is there any medication that could possibly cause you to have an episode that could impact your function? So if you're taking a medication that's, say, a muscle relaxer, if you come to PT and you've taken that, I'm going to be more cautious with you, because I don't want you to fall. Because muscle relaxers now, they relax everything. They're not going pinpoint to the area that's bothering you. And even with someone who has diabetes, you want to make sure that they've eaten before they've come to therapy, or you need to be aware of all of the different signs that could possibly affect them, because exercise does lower your blood sugar levels. And so we don't want to do anything that's going to cause you to have a problem. So getting with your nursing staff, your physicians, to know all of that information, but then working, say, with a an occupational therapist. If you're having difficulty going to the bathroom, if you're having difficulty dressing yourself, working with possibly a speech therapist. If you are having some cognitive issues, not really remembering things, having issues with word finding, those things are more of a speech therapist realm. Say you're working with a nutritionist and your goal is to be able to weight bear more, but you want to weight bear with less weight. So you're working with a nutritionist that's going to work with your diet to help have you eat the right calories. All of those things are kind of how we work together. So I've only talked about a few professionals, but I think those are the ones that we would all be able to understand the most.
With the rise of digital health, telemedicine, how
Mhm.
has that impacted physical therapy from your perspective, and what can the individuals or clients expect vis-a-vis the, online versus in-person experience?
So I wanted to do telehealth before COVID began. I thought it was just a great tool for you to use, and that physical therapy could be a viable option. So the global aspect, PT was kind of hit hard. A lot of people were not ready for telehealth. With limbs and things, it was how I did therapy during 2020 the most.
Mm.
I still do telehealth now, but a lot of it was more of a facilitation, trying to help you get more to the end goal. Because with physical therapy, the goal is not to stay with you forever, but to give you the tools to be independent. And so when you're on the computer with someone, kind of like we're talking now, being able to show you different things, And then having someone with you, especially if the person has more of an involved case, to help you facilitate doing some of the motions that we would be doing together via the computer. But it's a great way, even now when there's bad weather, having the option of telehealth instead of canceling the visit altogether is beneficial for both me and the patient.
Yeah. So looking into the future, I know I'm not asking you to pull out your crystal ball, but as you look into the future, hopefully once COVID does subside, at least enough for individuals to feel comfortable to go back to the physical therapy or to go see their physical therapist, are you
Mhm.
going to continue? Like you said, you've been doing this before COVID came. So do you envision going back to the way it was before, or 50-50 with regards to online and in person? What does that look like for you and potentially others in your industry?
For me, I think I want to keep it the same. So if someone tells me like they're ill or someone has a case of something that could be contagious, then having the option of telehealth, granted they're feeling well enough to do therapy with me, but keeping us both safe via the computer, that helps us both to continue to reach our goals together, but also to maintain our safety. So for me, telehealth will continue.
Somebody has asked another question about aging. As you know,
Yes.
Dr. James, we are an aging society. As
Mhm.
as the demographics rise with regards to older individuals, how has that impacted your business with regards to your clientele and health issues?
I think it has made it more popular. Um, my oldest person is 93, and I have three 90-year-olds in that realm. And then I probably have about 10 between 70 to 80, and all of them are still wanting to get better, to do something they haven't been able to do before, or wanting to do it in a manner that they were previously able to do, or get rid of an assistive device, or be able to see and go up and down their steps to visit their children. So the idea of therapy throughout the ages, I think, is something that will continue, especially as we get older, and it will make it even more of a necessity because we're seeing that we still want to move as well as we have previously, because being an aging population, we're all just getting older, but we're not such at a point where we don't want to do the things we used to do. All right. So I hope that has been helpful for you to see how inactivity versus aging can affect you. And hopefully you'll choose to be active even as you are aging. My name is Dr. Chanel James. I'm the owner of Limbs and Things, a mobile and telehealth physical therapy practice. I serve aging adults in DC, in Prince George's and Montgomery counties in Maryland, and in Northern Virginia, covering Alexandria, Arlington, and Falls Church, Virginia. And this is how you can reach me. My number is 202-643-2636. My email address is limsandthings@gmail.com. And you can find us on Facebook or Instagram at Limbs and Things LLC. And every Saturday, first Saturdays at 6 p.m., you can find us on Facebook and on YouTube, where we are talking on Pull Up with Limbs and Things to local businesses as well as some national that provide resources to aging adults. And you can also find us online at limsandthings.com. We are in network with Medicare Part B and TRICARE, and we accept private pay as well.
Excellent. Really good. Thank you so much, Dr. James. If you wouldn't mind, can you spell out Limbs and Things, please?
Sure. LIM as in Mary, B as in boy, N as in Nancy, THIN as in Nancy, GS, Limbs and Things.
Very good. Just want to make sure people can find you online. That's
Sure.
the main thing.
Yeah.
Perfect. So as far as knowledgeable aging, you can find us on our website, knowledgeableaging.com. You can go there and see all of our upcoming and archive webinars. You can go to YouTube, type in Knowledgeable Aging, encourage you to subscribe. We update that a couple times per month. If podcasts are your thing, you can find us on Apple Tunes, Spotify, etc. Before I finish up, Dr. James, I want to say thank you so much. It was a joy speaking with you.
Thank you.
But yeah, I hope we can do this again. But till next time, I'm your host, Jason Kotar, and this is Knowledgeable Aging.